It's been exactly 2 weeks since I had my open heart surgery. I did go to the doctors today to get my drainage tube stitches removed. So here's a little random snippet of me walking to the doctors. There you are. It's been 2 weeks since I had my surgery. If you didn't know, I had open heart surgery, pulmonary valve replacement. So quite a major procedure. The recovery is about 3 months. I'm feeling quite rough today. Been a bit rough for the past couple days. I think I had a couple days that I felt quite alright, but you know, when I feel good, it's like I got to remind myself I can't reach out and grab stuff. Like I'm holding this phone, but my arm isn't properly out because I can't do that, because yeah, I got to keep quite close together for it to heal good. And yeah, so that's the hardest thing. It's just my brain is like, oh, I'll go do that, go do this, because obviously 20 years, you know, I've been able to do whatever I want. And then now it's like I got to be careful for the next, you know, couple months, and not pick up anything too heavy, and not reach out and grab anything that has a bit of weight, and also I could feel it anywhere in the chest, you know, so I could feel that I accidentally pushed on that a bit too hard, or accidentally, you know, picked something a bit too heavy or anything like that. So I've been quite fortunate with the, you know, initial recovery. Literally, I got into hospital on the Tuesday, the 8th of October. Got in there at 9 a.m. and then had a bunch of tests and stuff, and then had my surgery done at 8 a.m. on the next day. So I stayed obviously the night at the hospital, and then at 8 a.m. in the morning, obviously before the surgery, I had like a shower and to use a certain shower gel. You obviously, you know, get rid of bacteria and stuff. So yeah, so at 8 a.m. I went into surgery, and you know what they do, but I didn't realize this. I didn't realize gas was only for kids. You know, I had surgeries growing up, you know, a bunch of surgeries, and I used to get the needle in the back of the hand, and they used to put cream on it, because obviously I was a kid. They used to put cream on it, and they used to like do that, and then I started having gas. And then now that I'm an adult, I didn't realize you only get the needle in the back of the hand without numbing cream, but it wasn't that bad. They injected, you know, the fluids that make you fall asleep into my hand, and within, you know, within 30 seconds to a minute, I was out of it. Woke up. I woke up panicking. I had like a panic attack as soon as I woke up. My memory is blurred of it, but I remember, yeah, just like going like that. Embarrassing, but it is what it is. You know, that was out of my control. So yeah, just happened. But yeah, I'm just feeling quite rough today. But yeah, so I came out on the Monday. So I was literally in hospital for 5 days. They said to me I would be in hospital 5 to 7 days, in intensive care for 3 to 4 days. I was in intensive care for about 24 hours. Then I got moved to higher dependency for like a day as well. And then I was in normal ward for the rest of the days until I left. But yeah, obviously it wasn't easy. You know, you couldn't really use your arms too much. And like, I've only just started being able to use my arms quite good, but obviously I got to be careful reaching out, you know, holding this phone. I'm being careful, you know, I can't like reach my arm fully out and hold the phone. It's not good. So yeah, there's just certain stuff. I got a little after surgery little book thing that I can just read to recap on what I should do. Yeah, I think the hardest thing is just going to do something that you always do. Maybe it's closing the blinds, going to close the blind, and then it's like, oh, I can't close it like that. So I close it, really takes me like, you know, 30, 40 more seconds than it should, because I'm not like doing big, because yeah, it's not really good. But yeah, I was going to show you the scar. I might put a photo on of the scar at the moment. I'm not too sure. All depends if I feel like it. I might not. But the scar starting about here all the way down to about here. And then drainage tubes. Oh, don't get me started about the drainage tubes. Wow. They were some of the most pain I've ever felt. You know, I've been fortunate enough to not really feel too much pain, physical pain. You know, I felt obviously quite bad physical pain from other surgeries and other things, but this was next level. I mean, you know, for some people, I guess it isn't that painful because there was elderly person next to me getting his drainage tubes out, not at the same time, just a couple of days after mine. And he was like, "Oh," like he didn't really react. It didn't sound like it anyway. So he was like, "Oh, that wasn't too bad." Nah, for me, on my days, I was like, I was tensing, I was like that. It was so painful. It's basically, if you don't know what drainage tubes are, it's basically what they put in for after the surgery. So it takes out all the fluids, unwanted fluids that is around your heart and lungs and stuff like that. So it takes all that out. So obviously the drainage tubes are like, I'm not sure if it's connected to your lungs, but it's connected around your lungs, and it can collapse your lungs, you know, when they pull it out, if they do it bad, I'm assuming. But I had to have chest x-rays. I had two. Unfortunately, the top of a lung had like a dark, I don't know, on the scan it showed like a dark shadow, which means that it collapsed. Just a tiny little bit of the lung collapsed, and they said it's nothing to worry about, so I'm gonna go with them. But yeah, the drainage tubes were awful. So obviously it's all connected up here, you know, onto the lungs and everything. And then they go, you have to breathe in, breathe out, breathe in, breathe out, breathe in, hold. They pull them out, and it's like, and they pull it out, and it's like some of the worst pain. Like I was on morphine and everything, but it was painful. And then you start breathing again. So you have to hold your breath while they pull it out. I'm assuming because obviously the lungs, maybe it's better for the lungs to be, you know, not full with air when they pull it out. So, but yeah, it was, yeah, I was not expecting that. I am just glad that I'm hoping I won't have to deal with that for another 20 years, I'm hoping. But the surgeon did say that you shouldn't need a replacement of the valve for another 20-40 years. So that is amazing if that's, you know, if he's correct with that. I'm sure I'll have other surgeries before then, you know, because there's other parts. You know, I got a heart condition called tetralogy, so it's made of 4 parts. So obviously I'm sure there might be something else that I might need surgery for, but it'll most likely be keyhole, which will be better recovery, and I won't have to open this up again, which is nice. But yeah, so yeah, that's really it. You know, I was in hospital 5 days, came out on a Monday, rested for the rest of the week. I didn't really go out until like the Sunday, and then I went for a walk, and then I went doctors on a Monday and took those stitches out. But unfortunately, the drainage tube stitches, 2 of them weren't sealed properly. Like it wasn't sealed, so she had to put butterfly stitches. And then today, Thursday the 24th of October, she took the butterfly stitches off, and fortunately it has sealed, so that's really good. But yeah, weekly I have to take a photo of my scar and send it to the hospital that I had my surgery done. I really do appreciate the surgeon and everything. He did my surgery and made sure that I was ready to go home and recovered, so appreciate it. But yeah, guys, this is me. You know, I feel rough today, as you can probably tell. I'm just got to rest and stuff, so hopefully I could do another video before my recovery is gone. I'm sure I will, because that's, you know, January will be when I'm fully recovered from, you know, fully healed, hopefully by January. So hopefully I can film some videos before then. But most likely you won't see me for another couple weeks, most likely, or a month or so. I wanted to get this one out. But yeah, guys, so I'm just just recovering, resting, you know, going on walks sometimes, but at the moment I just need to rest. Unfortunately, before I went to the doctors, my foot slipped on the stairs and I fell right on the front, and my arms went back and stretched that out. I don't know if I mentioned it already, but yeah, guys, apologies. You know that this video isn't really much, but you know, hope you understand that I'm recovering and stuff. But yeah, I appreciate you watching it, and yeah, I guess you know, maybe I'll update you with the recovery later on. It's currently been, it was 2 weeks yesterday since I had the surgery, so yeah, it's been about 2 weeks since surgery, so that's not bad, you know. And I've been home for a week. Like, that is amazing. You know, that's amazing that I've been home for over a week and 4 days, a week and 3 days or whatever, out of the 2 weeks since my surgery. That's amazing how quick it is, you know, because as a kid, it's like I used to have surgeries and I used to be in hospital for 3 weeks, you know. And then having a major surgery like this now and being able to leave 5 days after is amazing. And even the nurses were like, wow, like, you know, you're recovering rapid, you know. So, but yeah, guys, yeah, you know, I got medications and everything that I'm taking every day. I'm just, yeah, I'm a bit out of it in my mind. I'm a bit, you know, I'm just recovering. You know, if you think about your body, you know, my body is healing inside. You know, there's a whole new pulmonary valve, you know, in there. You know, there's, you know, a lot has to heal. You know, my ribs has to, you know, because obviously they spread apart your ribs and like they cut, you know, through stuff, so that has to all form back together, that has to all heal, you know, and then the actual scar has to heal. So there's a lot that your body is doing, so it ends up making you tired, and you'll you know, I'll be tired for a while, probably for a couple months, I would say, but hopefully, you know, I'll feel quite normal very soon. But the bad thing about feeling normal is my brain will go like, oh, I'm gonna grab that thing, or I'm gonna pick up that thing, and then it's like, and then I quickly remind myself, I'm like, no, I can't do that, I can't pick that up, too much that's dangerous, I can't do that. But it's like that initial going to grab something, because I'm so used to, you know, being able to do what I want, but now I can't, because I got to be careful, you know, because it's healing, and if I snap anything that is inside, that's it really. They got to, whatever, they might have to do surgery again, I don't know, so we got to be careful, man. But yeah, I feel blessed to be 20, I feel blessed to be young and have this surgery. You know, I'm not looking forward for 40 years when I'm 60 having a surgery like this. You know, nothing to worry about now. Let's not worry about it now, you know what I mean? It's a long time away. I wonder what life will be like, you know, in 20 years when I have my next whatever surgery. Another pulmonary valve replacement when I'm 40. You know, that's crazy. You know, it's crazy. But yeah, guys, we'll see you with a new video sometime soon, probably in the next couple weeks or months, so not too soon. But yeah, guys, apologies for just, I don't know why I'm saying apologies, like, you guys know that I'm recovering from it. But yeah, if you want to check out any of these videos, check it out. We'll see you with a new video, guys. Not next Sunday at 5 p.m, on a Sunday at 5 p.m, but it might be in a couple weeks or months. But yeah, I feel really rough today, so I'm just gonna rest, and yeah, have a beautiful rest of your day, or rest of your night, or rest of your week, and hopefully see you again very soon. Appreciate you watching this far in the video, just a talking video, but yeah, peace, see ya. Not sure if you have noticed or anything, but I have lost quite a bit of weight. I think I lost a couple kilograms since my surgery, so you can see it's a bit bonier, stuff like that. It might be a good thing, you know, but I could see it, you know. I was watching the other clips that I was watching the clips that I did, and I could see how bony and like how skinny I've gotten. So yeah, I've lost a couple kilograms since surgery, but yeah, I just thought I'd mention. If you notice, you might not notice because you might have been new to this channel, and if you are, make sure to subscribe, give this video a like if you do, if you want to, and hit that notification bell, because it could be in a couple weeks that I upload a video, or in a couple months, I don't know. Usually I upload videos every Sunday at 5 p.m, but you know, I'm recovering, so it'll probably be, you know, a couple weeks or in a month. So yeah, guys, see you very soon. I don't know when. Peace.